wanted to drop you a quick video and ask you a question. What's the most dangerous thing a physical therapist, physician, chiropractor, massage therapist, personal trainer can do to a patient? So the most dangerous thing, what is dangerous, and what's the most dangerous thing we could do to somebody who's coming in to see us for help? So let me give you the background on where I'm coming from this, with this story, or with this question. So here's a story about a patient that we saw last week, dancer, and he's got a history of low back pain, history of plantar fasciitis, and his main complaint coming in was that he's got this knee and hip issue going on. So he came in and I looked at his intake, and on his intake it's got that he circled that he's seen the chiropractor, he's seen physical therapy, he's seen massage, he does foam rolling, he does Theragun, he does stretching, all that kind of stuff. So typical dancer thought process. So you get this community that wants more and more motion and more flexibility, and they get tighter and tighter as they seek more and more of that, because the way they're trying to obtain the more range of motion and more flexibility is actually making them worse. So this is the mindset with these people coming in. So I'm already ready for this guy to tell me what I already know he's going to tell me. So get him in, and he tells me about how he has this fantastic physical therapist in a different town, but he's not in that town right now because he's doing a show somewhere. He's doing a show here. And that physical therapist totally got rid of his plantar fasciitis by giving him inserts, and he makes sure that he rolls his feet on a ball daily and does his calf stretches. So I said, okay, put that in the memory bank. And then he's also got, this MRI that shows that he's got fractures in his back, and he's got fractured discs, and all this stuff going on there. And then of course he's got sciatica, and he's got IT band syndrome, but his chiropractor that he was seeing is a fantastic chiropractor, got rid of his IT band syndrome, of course, as long as he continues to foam roll multiple times per day. So here's this guy who's seen 3 different people. He saw for the low back problems, obviously got an MRI and x-rays ordered by a physician who told him that he's got these fractures in his discs. Now, do I think the physician told him that? No, but here's the most important part. It's not what you tell them, it's what they interpret you saying. That's the important thing. So what he interprets this physician saying is, and his MRI saying, is he's got fractured discs and a bad back, and he shouldn't be getting out of lumbar neutral. So that guy's program and way to solve his problem is don't ever get out of lumbar neutral, because that's where your pain is, and that's what's going to break your discs. All right, so let's break down the information that this guy's been given, and more importantly, how he's put this into his memory bank and instilled this into his belief system. So the doctor, the physician, told him that he's got fractured discs, and the only way to keep those from getting worse is to never get out of lumbar neutral. The chiropractor told him that he has IT band syndrome, and the only way to deal with that, and sciatica, the only way to deal with those is to foam roll the crap out of his IT band multiple times a day. And then the physical therapist told him that he's got plantar fasciitis, and the only way to deal with that is to roll his foot on an ice bottle and the orthotics, and stretch his calf constantly. All right. Holy cow, sun just came out. Hold on one sec. Okay, holy cow. Okay, so here's his beliefs. Don't move. Anytime you feel tight or pain, do these things. And then make sure you're doing these things also before you dance and before you do all that kind of stuff. So here's what he's been told. And he believes that he's better, but he's not. He still has all of the problems that he had before he saw those 3 geniuses. He's just doing a bunch of garbage to try to cover it up. And along the way, as he does that, he's actually making himself worse. So he comes in, tells me his story, shows me how fantastic his orthotics are. And as I'm watching him move, he's a dancer, and he literally sits down. When he comes in to sit down, he literally sits down like this and stands up like this and moves like this, because he's got to maintain lumbar neutral, because that's how he's going to fracture the discs in his back. He's a dancer. Do you think he's ever going to be in lumbar neutral? And he's doing shows and musicals and all kinds of stuff. So even if you're not a dancer, you're never in lumbar neutral unless you force yourself to be there. So here's where I come in and say, so tell me, like, what would happen if you didn't foam roll and stretch and ice bottle roll and all that? Oh, well, I'd be a mess. And I said, so actually you're not any better than you were. You have the exact same problems that you had before you saw them. And now you believe all of these false narratives and all this nocebo talk, which is actually keeping you locked in the position that you need to get out of. So I'm going to tell you why those three people are wrong. And I'm going to tell you why. I'm going to show you, I'm going to demonstrate to you why you're making yourself worse with what you are doing. And then I'm going to give you things to do instead of what you've been doing to actually get better so you don't have those problems. So this is obviously mind-blowing to him. And I start talking about, well, did you know that when you stretch, you're actually turning your muscles off, which makes them tighter, which makes your symptoms worse, which makes you stretch more, which makes you worse. And did you know that you're orthotic? So I start testing facilitation, and none of the muscles that control pronation are working. So I said, so see how when I put your leg in this position and I test you, you can't do anything, but when I rotate you the other way and I test you, you can stop me? And he said, yeah. And so I break down, have you ever heard of pronation? Well, yeah, I heard of pronation. That's really bad. That's why I have to wear my inserts. So I test all the muscles that should be stabilizing and controlling pronation, which he fails, and then tell him, well, the reason why you're failing those is because you have these inserts in your shoes that you wear 24/7, and your foot never goes into pronation. So the muscles that control pronation no longer have to work. So that's why those are worse, and that's why you're stuck in the insert. So we're going to get you out of the inserts, and we're going to throw those away, and you're going to be barefoot at home, and you're going to dance barefoot and all that kind of stuff. And he's like, and oh, by the way, you're not going to stretch anymore because flexibility is bad, because flexibility is range of motion with no control. What we want is motion, strength, and stability all together, which is what we call mostrability. So we're going to exchange unsafe flexibility for safe mostrability, which will actually help you perform and eliminate your pain. So as I go through and break all these things down and tell him he's not going to do these things, he's starting to kind of absorb it. He's still hesitant because this is what he's been told practically his whole life. He's probably 30-year-old dancer, so he's probably been dancing for at least 20 years. He's been told this his whole life. You need to be flexible, you need to stretch, you need to break down the tight muscles and the bad muscles and blah, 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 blah. So in the span of a half an hour, I'm going to take away everything that he's been doing, everything that he's been programmed to believe, prove why that's wrong, do a stretching demonstration on him so he can see what happens with just stretching 10 seconds. And oh, by the way, it's the same effect when you roll and massage and all the other stuff that he's been doing. So now let's go back to my question. What's the most dangerous thing you can do with a patient? Would it be really dangerous to give somebody the wrong exercise or not coach them on how to do an exercise correctly? That wouldn't be good. Would it be dangerous to not give them anything? Just kind of like play around and just modify symptoms, that kind of stuff real quick, and not really give them anything to go home with? I don't know if it'd be dangerous. It'd be a waste of their time. But what would be dangerous is filling their head full of garbage because you are not, or whoever is giving this information to them, is not taking apart their thinking and actually applying science to what they are talking about. So telling somebody that they have fractures in their back, whatever the physician told them, he didn't need to have an MRI. All that does is fearmonger. So stop When people come in and they bring me their MRI, you know what I do with it? I put it on the table and say, I don't need that. I'm going to evaluate you and see what's going on. I don't need to know what your picture looks like, especially if you're a 70-year-old with low back pain. I don't give two shits about your MRI or your x-rays. I already know what your back looks like. Okay? If you're able to walk in here and you don't have constant pain shooting down your legs and debilitating low back pain, like if you walk in here and it kind of hurts when I do this, and I don't need to see a damn MRI. That's a complete mind fuck for people. Stop entertaining MRIs and imaging. If somebody brings you that stuff, put it away. Say, I'm going to evaluate you and figure out what you are doing functionally, which will get me to the root cause of your problem, rather than fear mongering and giving you all of this garbage in your head thinking that you can't move. Okay? How dangerous is it? The information that the chiropractor gave to him. Well, you need a foam roll. Well, so I told him, I said, so when you foam roll, what are you doing? He's like, well, I'm lengthening my IT band. I said, do you know it's physiologically impossible to change the length or the shape of your IT band by rolling on a roller? So he had a leather belt on. I said, your IT band is like this leather belt. I can mash this leather belt all day long and it's not going to change. The same thing goes for your IT band. A, your IT band isn't your problem. And B, if your IT band was your problem, mashing it with a foam roller is going to do nothing. Okay? So how dangerous is that information? So now he thinks, now he's paralyzed by this belief that he's got this tight IT band, and the only way to keep it loose is to keep foam rolling, which is 100% garbage. Now let's get to the physical therapist. Now he's got garbage in his head about plantar fasciitis. I have plantar fasciitis. I'm disabled. I need to wear these inserts in my shoes. No, you don't. You need to figure out what the problem is, fix the problem, and your plantar fasciitis goes away and you don't have plantar fasciitis and you don't need to do all this garbage. So here's my point. The most dangerous thing that you can do with a patient is give them these false beliefs, this false information, these fairy tales, these flat out lies, nocebos, and false narratives that makes them believe they are stuck doing something or they have to do something every time they feel a symptom. So when we educate patients, we say, this is what we're doing, this is why we're doing it, this is why it is 100% built on science, physiology, neuromuscular physiology, anatomy, biomechanics, science, not fairy tales about inserts and foam rolling and stretching and cracked discs and all this other garbage, all right? So when you educate them with that, you give them a tool. Now they understand why I'm going to give them the exercises that I'm going to give them and what those exercises do and what the purpose of those exercises do. And they understand that if symptoms come back, they can do these. This is not something that you have to change your whole life and do these all the time. No, you're gonna do these exercises on a regular basis 3-4 times a day for the first 2 to 3 weeks so we just can get things reprogrammed. Once that happens and your body builds the muscular endurance, builds the neuromuscular facilitation, normalizes biomechanics, you're moving normally, then you're good to go. Are you gonna have bad days? Yep, just start doing your exercises. Do I say, don't do that, don't move this way, don't? No, I say do. Do more of what you want to do, as much as you can do it, and then change what you want to do whatever, and you should be able to do those things without things falling apart. And if they do fall apart, then come back and I got to figure out what happened there and probably give you some new things for homework. All right. So keep in mind, if you are giving patient education and you are giving them a diagnosis, so this is one of the reasons why I don't ever tell people what their diagnosis is. People that want a diagnosis are stuck in this, I'm afflicted with something mindset. No, you're not. You have a little bit of a problem that we're going to get rid of. So when I told this guy, this is gonna be like 2 to 3 visits and you're gonna be 100% fine. He's like, what? Well, I go to the chiropractor 2 times a month, and that was after I went 2 times a week. And then the physical therapist, 8 times. Like, how are you gonna fix all this in like 3 times? Well, first of all, I'm not gonna make you worse by doing all the garbage they did. I'm gonna take away all the things that are making you screwed up in the first place. Then I'm gonna give you things that actually work and normalize your mechanics and your function, and that's how you're gonna get better. It's not rocket science, all right? It's paying attention to your patient's functional ability, getting to the root cause and reversing that. All right, so long story short, I always talk too much. This video went too long. Stop just giving people things without thinking about what you're doing, how that information is landing on them and what they are interpreting that information as. And then, are you building confidence, or are you fear-mongering and tearing them down and making them think that they have some affliction that they have to do all this garbage for? All right? The worst thing you can do with patients is lie to them, misinform them, make them believe they have something they don't, make them believe that this, whatever you're going to do for them is going to help them when it's actually not, but you don't understand that because you didn't take apart your thinking and you didn't apply the science that you learned in school because they never taught you how to do that. All right, so here's all of the things that are wrong with the broken medical model. If you're finding yourself stuck in that and you don't know how to educate patients without nocebos and protocols and diagnoses, then you need to figure out how to reinvent your thinking and your skill set, which will actually give you the ability to give patients education that will actually work for them and help them get better rather than make them go backwards. All right? Got questions or comments? Let me know. Have a great day.